This is All India Radio, and now it's the time for weekly program, Our Guest. I hand over the mic to the show host, Nitish Arora, for the same.
Good morning, listeners. Welcome to the weekly program, Our Guest. Before I introduce our guest for today, let me briefly state the context. Sports injuries are a great dampener, but some players wear injuries as badge of success. Many players are not that lucky. In the field of cricket, we have seen players like Hardik Pandya, Jasprit Bumrah, Shreyas Iyer. They all got recurring injuries. And we today try to analyze the reasons behind such frequent breakdowns of players' body and the kind of injuries and reasons thereof in a conversation with our guest today. And our guest today is sports injury specialist Dr. Jawaharlal Jain. Dr. Jain, welcome to All India Radio.
Thank you.
My first question is, what are the common sports injuries?
Commonest sports injuries: sprains, strains, fractures, dislocations, knee injuries, shoulder injuries, and head injuries also. The commonest head injury, we call it, is a concussion. As probably you remember, long back, Raman Lamba, one of our cricketer, he was playing in Bangladesh and he got an injury on head, a concussion. He was hit by a ball. And initially it was in concussion, but there was a subarachnoid hemorrhage, and we ultimately lost him. Raman Lamba died of head injury. The head injuries are common, but they are ignored. The sportsmen, they just ignore it, and they don't go to the doctor. They don't get their x-rays done. They don't get their MRI done. They don't get their CT done. They feel it is just an episode of mild unconsciousness, mild dizziness, or mild vomiting, or mild vertigo. Never ever ignore.
Concussions and head injuries, you said that most of the time the cricketers are not taking it very seriously, but nowadays a recent episode of the young Australian cricketer, who lost him to the head injury.
Yes.
And now the people are very serious, and the
certainly.
moment the ball touches your head and the physio is in.
Yes, certainly.
And what do they do when they come in? What do they check for?
Normally, in case of head injury, they ask the athlete whether he has got some signs of vertigo. Is he dizzy? Is he trying to do some nausea, vomiting, or dizzy, or giddy, or feeling of unconsciousness? If all these parameters are okay and there is no headache, if there is no headache, there is no vomiting sensation, there is no nausea sensation, there is no giddiness or dizziness or feeling of unconsciousness, then he is okayed.
Since we started with cricket only, what do we normally see, that cricket has become such a professional sport?
Yes.
But every now and then we find that one or two cricketers are out of a series because of some injury.
Yes, certainly.
Although I think if we compare cricket with let's say hockey or let's say football, the pressure on the body is far greater in football or in hockey, though they are limited to 1 hour or 2 hour sport.
But certainly in cricket, the pressure of money is tremendously high. I will call it that is a very, very big reason, because you see the cricketer wants to do too much in too little time.
Okay.
That is one hallmark of the problem, that he wants to do too much in too little time. He wants to get back to the work, but then even if he is not fit, he wants to play for country, and that is the reason why he is out, plays in one series, and then suddenly he finds that he's got a hamstring strain, he's got a groin strain, and then suddenly out of the series, and then he comes back after one month, and then again he got some back injury. So there's a repetitive stress, and not doing a proper conditioning, not getting proper physio rehabilitation, improper rehabilitation also means maybe at the rehabilitation academy as we have. If he is advised rest for about maybe for maybe a month or so, and they want to get back to the work, they want to get back to the Indian team, and if he does improper rehabilitation, maybe only does for about 2 weeks or so, and if he is advised for 3 weeks or 4 weeks, and then if it is an improper rehabilitation, certainly the injury is bound to recur. Injuries are bound to recur, and he has to pay a very heavy price for improper conditioning, improper rehabilitation, and the injury not getting well and then coming back to work.
You mean to say that there's too much of cricket actually,
yes.
And the cricket should be that cricket calendar should be limited
yes,
to.
Cricket calendar should be limited, and maybe the players, maybe if they could be rotated as per the board practice, that if they can be given some rest for some period, and then the different set of players may be asked to play for India. So he gets body should get some rest, and body should get some condition. You see anything, whether it's a series against New Zealand, then immediately against West Indies, then IPL, players are continuously on the move. They hardly go to their homes. They hardly go back to their families, and so there's no recreation. There's only competitive sports. And cricket is so competitive these days, you can't afford. If you don't play well, don't perform well, you could be out of the next match. So they want to be in the team, but not taking that much care of the body.
But is it that easy for them to hide the injury from the selectors and
if they don't tell? If they don't tell, say if you are practicing in a warm up game, or if you are practicing in the training, and you don't tell what you're suffering from, the selector or the coach will not be able to know whether you have a hamstring pull or something. If he's looking all right.
But now we have various kind of tests. I think
they are
there's one test which is yo-yo test, which was made very popular.
It used to be done. But you see, if the tests are not being done that frequently, and the athlete feels that yes, I am fit.
Okay.
You see, you have to rely on the word of the cricketer. If he says yes, I am absolutely fit and I can take on the match, then what would you do?
Okay, there is one injury that is become a household name for everybody who is following cricket or watching it on or listening it on radio. Commentators are telling it hamstring injury. What is this hamstring?
Yes, it's a strain. It's a strain on the muscles or tendons, and the ligament injury is called a sprain, and the strain or the hamstring pull, it's a strain on the ligaments, on the muscles and tendons at the back of the knee. And the most important problem is the athlete or the cricketer, whatsoever, if you say cricketer, they feel a lot of pain in walking. And at times it happens because of dehydration also, because the dehydration is a very big problem, and muscle cramps are invariably seen. You see a bowler bowling at the speed of 140 kilometers and suddenly jumps and sits at the near the umpire, and and sits down. It happened a couple of times in case of Hardik Pandya. So so that dehydration can cause this, and repetitive stress, repetitive stretch, improper stretching, improper warm up in the morning can give rise to this hamstring. Quite a number of cricketers or athletes, they are getting it repeatedly. That is a big problem. If there is a groin strain, as it happened in case of KL Rahul, these things definitely they take a long time to heal. And proper conditioning, proper rehabilitation by the team physio or by the trainer, whatever is there, and then they can be back in action. But certainly it's a common injury. Is
age also one of the factors, or you can have a sports injury at any age?
Sports injuries can occur at any age. Irrespective of age, the injury can occur. If you are not fit, if your body cannot take that much exertion, cannot take that much weight, injuries can occur. But normally, yes, as the age advances, the reflexes can be slow, the flexibility will be slow, flexibility will be low. So then there is more chances of getting injury. Young athletes, young cricketers, they are more careful about their body fitness, they're more careful about their body technique.
On the contrary, I think youngsters are actually not bothered about this. That we are young and we are youthful, we have energy.
Yes, it's a myth, it's a feeling, but they have to look forward to their career in the long run.
Absolutely, this is
if
one
they
point.
Have to look forward to their career in the long run, because supposing a player plays only one test match, and he is not fit and he is out because of injury, then there is a possibility that he might get back again.
Otherwise also a player has got a very short life.
Very short life. These days, very short life. How many tests like Gavaskar has played? Those days were very few cricketers and nobody could replace him for a number of years. But these days, if you leave one player, then the second player is already there. So
Absolutely.
They have a problem of which best cricketer to select from.
So we come to that all very important question, which I think only a sports injury expert can tell. We say that prevention is always better than cure.
Yes, certainly.
So what are the basic things that anybody who is listening to the program and is a sports person should take care of?
For prevention of any injury in sports, the first hallmark is that you have to do a proper warm-up before the game. Proper warm-up is very, very necessary. Your body should be conditioned to that amount of play. Say if you are playing a hockey game on an AstroTurf, then your body should be able to take that much exertion, that much weight for a duration of the game. Not that you are fit for only 30 minutes play and you want to play on AstroTurf for 90 minutes. Okay. So your body should be conditioned to play that to take that much weight. So your first is your flexibility, your strength training, your weight training. All these parameters should be visualized, should be analyzed by the team physio, by the team doctor, and improper techniques, the technique should be proper, that should be visualized, and proper gear, protective gear, that should be very, very cautiously chosen.
For any match and for every match.
For any match and every match. Like your shoes should be proper. Your shoes should be proper. Your helmet should be proper. If the helmet is not proper, and you just a ball is hit and the helmet goes in 20 meters, so the helmet should be properly fitted. Your gloves should be proper. So the protective gear should be there, like gloves, elbow guard, or an abdominal guard, or the shoes improper. The shoes should not be, ill-fitting shoes. The arch of the shoes, they should be properly maintained. So protective gear, protective equipment, proper warm-up, proper conditioning. If these things are...
and cool down also.
And cool down. And so if these things are, analyzed and managed well, I think the chances of injuries fairly goes down. But it is said that for any athlete, whether it is a cricketer or any athlete, the more the injuries, it is said more the ornaments he is wearing. So as it says in case of girls or ladies that they wear more ornaments. So I say if he has got 7 injuries, so he has got 7 ornaments on his body.
If you have not got medals, at least you have injuries to show.
Sustained injuries to show.
But then diet also plays a very good role.
Yes, diet also plays a very important role. I will certainly rate it. Diet, proper nutrition plays a very important role. You should have a balanced, proper nutritious diet. Not necessarily that you have to be non-vegetarian all the time. A vegetarian diet which consists of good proteins, good carbohydrates, proteins, fats, minerals, vitamins, and especially for your cramps at times, a lot of athletes in all sports, they get cramps. So for prevention of cramps, you must take a lot of water, minerals like juices, minerals, water, coconut water, that is very good, or carnitine, any medicine which contains carnitine. So that is the muscle fuel. So your cramps should not be there, and your diet should contain minerals, vitamins, but in adequate amount. Not that you have to take 4 vitamins daily, not necessarily. Take an adequate amount of diet. The nutritionist especially in government organization like Sports Authority of India or something, or the board also must be having their nutritionist. So they go on advising the athletes and to how much diet is good, how much protein and a particular game athlete should take. Like for boxer it is different, for cricket it may be different, for hockey player it is different, for table tennis player it may be different, for weightlifter it may be different. So proper nutrition, support of proper nutrition, proper physiotherapy, proper cool down, proper warm up, I think that plays a very, very important role in
and what about acclimatizing? Because these days the schedule is so chock-a-block and they have to go to various places, various conditions.
Yes, acclimatization is very important. It plays a very important role. But you must acclimatize according to the weather conditions prevalent in that particular region. As we went to Barcelona in 1992, I was the Olympic doctor. So we were sent about 10 days before, and so that our athletes, our players could acclimatize to the weather conditions in Spain. Normally it should be done like this, but at times certain people feel, why should we send the team 15 days in advance? They should go only almost 1 day prior to the competition, but then the team will not be able to acclimatize. It is better to acclimatize the contingent at least 10 days before the due competition, and a chef or your nutritionist and your diet planner, that should be also sent with the Indian team, a psychologist with the team chef, so that he can give you some
idea about what are the kind of meals.
What are the kinds of meals. So you can get those kind of meals according to your requirements.
So if you want to stretch your career, you must stretch yourself off the field also. Do a lot of exercise and do a lot of warm-up before actually hitting the field. And the injuries can take care of themselves because you are preventing those injuries.
Yes.
Thank you so very much, Dr. Saab.
That was Dr. Jawaharlal Jain, sports injury specialist, in conversation with the host of the show, our guest, Nitish Arora. Our guest program is aired every Monday at 9:15. Don't forget to tune in same time and same channel. Have a fabulous day ahead.